I'm Eva Freed. I'm the clinical director for the midwifery program and the women's health nurse practitioner program. So I will be speaking to the curriculum elements. And then we have a few staff folks here. Caitlin, do you want to go next?
Yeah, hey everybody. So glad to be here with you this evening. My name is Caitlin Rivard, and I am a clinical advisor for the midwifery program and the WHMP program, kind of east of the Mississippi. So my counterpart does the west of the Mississippi and Alaska and Hawaii. She's got the real interesting outlying states. So I'm happy to ask or answer any questions you may have about clinical placement tonight.
Yeah, and then before we turn it over to Bobby, I was just going to add that all of us are pretty good at keeping up with the chat throughout. And we don't want to just throw a PowerPoint at you. We know you can read. We just want to make sure that we're interactive and answering your questions. So you are actually welcome to enter questions in the chat the whole entire time, and we will keep up with them as best we can. Don't feel like you need to wait for Q&A at the end, and I'll pause with some key questions and make sure that I respond to them before we move forward. So Bobby, if you want to introduce yourself next, and then if I've missed anybody else on staff, and then Rosalie, I'll be ready to start with the first slide.
Hi, everyone. I am Bobby Linderman. I am an admissions counselor. So I will be here to answer all of your admissions and application related questions.
And did I miss anyone else that's on the team? Okay. So yeah, Rosalie, if you want to give me slide 1, that would be awesome. There we go. Okay. I guess we can go to slide 2. This, you all know, you came to the Frontier information session. Thank you. Thank you. Okay. I apologize. I just looked at these earlier today, but I forgot what order they were in. So I'm Eva Freed. I'm the clinical director. Eileen Thrower is the department chair, and we just take turns running the meetings, but I can speak to our didactic curriculum as well as our clinical curriculum. Next slide, please. So this is a picture of one of the things. You can read the mission to yourself while I explain. We do pride ourselves on providing a sense of community and structure, even though you're in a distance program. So there are 2 trips to campus, which we'll speak to about in more detail. This is our Bell Pavilion, and 2 of the special things. Yes, Takara, we are recording and we'll send it out to everybody who registered. So on the 2 trips to campus, we circle up under the Bell Pavilion, which is a time that we come together as a community of folks who are on campus and share our thoughts about the day. And then ringing the bell is also a special tradition that we have when students leave from the 2 different times on campus. And if this touchy-feely circling thing makes you uncomfy, the touching part is optional. This is a particularly touchy-feely group. We do like to create structure and a sense of community, but you absolutely do not need to link arms if that's not something that feels comfortable when your group is on campus. Next slide, please. Okay, so a few key things that make Frontier somewhat unique. Our whole foundation is our culture of caring, and the description of that in more details on our website. You do attend school from your home community, so students travel to campus one time at the very beginning of the program for a program called Frontier Bound. And that is when you learn how the whole program is going to work and start to build community among other folks that will be starting with you, and get to know some of the faculty and staff in person and create what we consider essentially like a scaffolding for supporting you in your distance learning so that you're not just out there behind a screen and don't know anybody. It's very common for students to think oh, this is silly, it's an online program. Why do I need to go there in person? And then to be really happy ultimately that you did attend in person. And then you go home and you do the whole didactic part of your program. So all the book learning classes all happen from your home community. And then you travel back to campus one more time in between all of that didactic curriculum and when you start the clinical part of your program. So that's something else that's really unique for us, is that you complete all of your didactic education and then you begin clinical. So you're not taking a gynecology course at the same time that you're in clinic utilizing those skills. We actually Make sure that you have sort of the book and intellectual understanding of all those skills. Then you come to campus again for the second time for a program called Clinical Bound, where you practice with standardized patients and models, some of the skills that you're learning so that you're ready to implement that knowledge when you go back to your home community for clinical. Next slide, please. So we have a huge program. We're by far the biggest nurse midwifery program in the country, one of the biggest women's health NP programs in terms of number of students admitted each term and overall number of graduates. We have alumni in every single state. And then those overall numbers include our psych mental health program and our family nurse practitioner program and our doctor of nursing practice program. But nurse midwifery is by far our biggest program. And then women's health NP is on par with some of our other programs. Olivia has a question: when we come to campus, do we stay in a dorm or a hotel? We do have on-campus housing. You'll probably be glad to know that post-pandemic, it's all single occupancy. When I was a student and went to Frontier, I was an adult who left my family at home, but I slept in a room with 4 people I'd never met before. And that had its own unique elements, but we don't do that anymore. So you get your own room with a door that shuts and locks, but there are kind of like dorm style, like shower or bathroom things and a kitchen, and some of that's fun. But also, if that sounds horrible to you, you don't have to stay on campus. You can stay in a hotel at your own expense. But if you're concerned about anything like that, definitely let us know. And then to the next person who asked a question, you are required to have 1 year of experience as a nurse in order to apply to the program. It's not specific to what type of nursing experience you need. Keep the questions coming in the chat, and I'll take the next slide, please, Rosalie. So lots of awards and recognitions. We've been in the business of distance education since the days that you had to take things to the post office and mail paper. So we were doing distance education way before the pandemic and even before the internet, amazingly. Next slide, please. So lots of support for students. Again, it's very important to us that you feel like you're part of a community when you're at Frontier. That's really critical to us, and that honestly, for the rest of your career, you're part of that culture of caring. And so we have, our faculty lives all over the country. Most of the staff is in the Versailles, Lexington, Kentucky area, but not all. But your faculty actually live in their home communities, and the vast majority of us maintain a part-time clinical practice. And so that allows us to know women's health nurse practitioners and nurse midwives all over the country, and to be familiar with the sites where you all will be going when you are doing your own clinical experiences. So we have regional clinical faculty, which are your course faculty while you're in your clinical experience. And then we have academic advisors and clinical advisors that help you navigate what to register for and setting up that clinical experience. We have online mentoring groups, and of course, all these other things that you're seeing here. Before we advance, I'm going to answer a couple questions. We do still require COVID vaccination, yes, but you can request an exemption to that requirement. For distance learning, yeah, this is a great question, Marissa, and I'm going to use words that, again, nobody knew before the pandemic, but now are common, which are, oh, now I can't think of it. What's that called when you do the class all together at the same time? Help me out, Caitlin.
Synchronous.
Yes, thanks, guys.
Yes.
I knew these words. I had children still in K through 12 when we had the pandemic, but you don't, and thank you, Olivia, for helping me out too. So you don't need to, when you come to Frontier, you never need to think like, I got to take Thursdays off from work because that's when my classes are. It's not synchronous in that way. But there are synchronous elements to every course. And the way that we do that is the professor for each course will post a gazillion available dates that are sensitive to people who work days, people who work nights, people who work weekends, people in all time zones. And you will sign up for the ones that work for you so that you can plan around your work and family schedule. So there are elements where you'll be online synchronously with a smaller group of students, but you always will have lots of options to be able to sign up for those. Everything else is asynchronous. Next slide, please. And staff, interrupt me if you think any of these are better for you to do, but I'll just keep going otherwise, as I normally do. So there's lots of scholarship money available. To get scholarships directly from the school, we do require that you have earned a minimum of 24 credit hours at the school, and you'll see a program of study showing you that. So basically, you have to demonstrate an initial investment and ability to be successful before you apply for internal scholarships. But there are more than 20 scholarships available, and you saw more than $700,000 available to apply for. We do have the nurse faculty loan program, Lauren, and I may be incorrect, but I believe that you need to be enrolled in the DNP program to be eligible for that. And somebody else maybe can speak to that. If not, we can refer you to somebody. And that's a specific thing that I'll pause and say right now. Many of you are probably very smartly comparing programs to make the right choice for yourself. This is not a BSN to DNP program. This is a master's program. And with you certainly can continue, make the choice to apply to and continue into our DNP program, but you will complete school with a master's. And to answer the next most common question, there's no evidence that anybody's ever going to need a doctorate in order to practice. Now, you may be in certain states or want to do certain things where it would behoove you to have a doctoral degree. But I don't see any evidence that it's ever going to be the case that you're going to get a master's and then someday you won't be able to keep your job. You might not be able to advance into leadership or something in certain departments. But I don't see any evidence that you would ever not be able to be a bedside clinician. And that's a conscious decision that we've made here at Frontier because we actually, there isn't any clear evidence that patient outcomes are improved when students are doctorally prepared, but the doctoral degree creates an extra, obstacle is one word for it, but a financial and time commitment before a student can get out and practice. And our investment is in improving the health of the communities that you all live in. So we want you to get a degree that demonstrates that you can go out and improve the health of the community that you're in. We're thrilled if you want to become a leader in healthcare in that community and come back for your DNP. And we've got a great seamless opportunity to do the DNP, but it's not a requirement for entry into practice as a midwife or women's health nurse practitioner. And MEDA or MEDA, you're in a common situation where you have a midwifery credential from outside the US. My understanding is that you do still need a US recognized nursing degree in order to apply because you will need to have that nursing degree in order to be credentialed as a nurse midwife or nurse practitioner. But again, staff, please jump in if I have any of those nuances incorrect. We have an office of clinical outreach and placement. And one of the things that office does is students often have understandable anxiety about how do I set up my clinical? And that's the case no matter what school you go to. Advanced practice nursing just is not set up like physician training. There's not like a match day and then you go to a residency program. And, there's good and bad things about that. But we believe that students know their own community. And one of Frontier's missions has always been to keep students in their home community, which are often underserved, rather than bring everybody to a metropolitan area and saturate that area with clinicians. So you're the expert in your own community. So you're the first sort of eyes on the community in terms of where there might be an opportunity for you to learn. But we have a whole office of clinical outreach and placement. I'll let Caitlin speak to that in just a moment. That helps provide assistance with identifying those resources and opportunities in your community. And I'm going to pause and let Caitlin speak to that. It's her expertise.
Yes, thank you so much, Dr. Freed. So it's really cool because what really sets Frontier apart from pretty much any other institution in my mind is that you will have an individualized clinical advisor that's going to be able to listen to your specific the things that you need to make your educational journey as successful as possible. So when we're thinking about what clinical placements you're going to need and you're going to want moving forward, we're going to look at where do you see yourself ending up in the future? Do you want to potentially live in a certain area? Is there a certain midwife that maybe you just really respect her care model and you would love to emulate that, his or her care model. I really enjoy what I do because no two students are exactly the same. And that's the fun part of it. And that's what keeps it interesting for us. So we will listen to your specific circumstances and find the opportunities that are right for you and work together to do that. So it's fun.
Thanks, Caitlin. Jeanne, I'm not sure if I said your name right. I responded to your question in the chat.
Yes. And it looks like there's a question about New York.
Yep. You want to speak to that, and then I'll respond to Olivia.
Sure, I sure can. Is it Alicia? That's a beautiful name. Alicia, New York is a little tricky. She's one of our fun states that we love to work with because there's such cutting edge midwifery practices happening there. But unfortunately, we are only able to accept 6 students per year from New York State for clinical placement. So, and that's rolling. So it's from August 1 to July 31st. It's 6 students within that calendar, within that space of time. New York is just one of those states that they really like for their students to come from brick and mortar educational institutions that are going to take their clinical spots. So we are allotted those 6 spots. And if you're lucky enough to get one of those 6 spots, then I can certainly help you get some placement opportunities in the great state of New York. It has to be outside of the boroughs. So just FYI, it does have to be upstate. What if I start in New York, but end up moving to another state prior to clinical? That would be beautiful. We would definitely welcome that.
Yeah, you can live in New York. It's just about where we place you.
Yes.
And so other people are starting to ask about their own states. If you're not in New York, no worries.
Yeah, New York
like
is
a
just
completely New York situation.
Yes, she's a special gal, that New York. And typically, if you're in kind of the city or the boroughs, we love. I think it's pronounced Hoboken. Hoboken. I always say that maybe a little wrong, but we have some other opportunities that are just over some state lines that we can look at. So I would just suggest meeting early and often, and we will get you set up.
And Caitlin, up in Westchester, is the issue that we can only place 5 or 6 in the state per year, but all those placements need to be outside the 5 boroughs? Is that
yes. So,
right? Okay.
So it is 6 students per August 1 to July 31st, but they all have to be outside of the boroughs.
Yeah, so there's still a numerical limitation, Alicia, but yes, you could have a placement in Westchester if you get one of those spots.
Yes, yes, yep. There's some pretty subtle nuances that I like my New York students, I like to meet with them first thing so that we can start chatting through those for sure.
Yeah. And Carrie, yes, you can even move out of state. And that's very common because usually you're in graduate school, in the same time in your life when you and your spouse or partner have job changes and you have children that, all sorts of things. And we have a lot of students that are in the military. So you can move wherever you want. Obviously, you don't even have to be in the US during the didactic portion. You just have to have access to the internet. But when you go to clinical, we just ask, and we'll go over this again, if you choose to, if you are granted admission and you choose to enroll, it's not like you'll never hear any of this again. But just when you let us know about your address change, we'll reassign some of your faculty and staff support so that the people you're working with understand the area where you're living. And the other thing is that you do need to have a nursing license or an appropriate, I have no words at the end of the day, that license that I have where you can work in other states.
Compact.
A compact license. I need to have my glossary for these meetings because my words get used up at 4:59. So yes, you either have to have a nursing license or a compact license in any state where you are doing clinical as an advanced practice nurse. Yes, and just to follow up on what Caitlin said, the midwife has to be in practice for a year before they can precept you. And there's often a several month gap between graduation and starting practice. So think about that. But if you have a friend that's graduating tomorrow, they probably will be in practice for a year by the time you get to the point where you would need them to be your preceptor. All right, next slide, please, Rosalie. Yeah, Olivia, that's totally fine. What you're asking. There's some nuances to that, but I understand the big picture and that's fine. Okay, so again, that's me with the tree behind me. That's Dr. Thrower, the department chair in the photo above me in the blue top. We both are accessible to students, even though we don't directly instruct in courses, we're always accessible to students for communication and support. And then the folks at the bottom, I wondered when I looked at the slide earlier how those lovely people got their pictures there, but that's just a sampling of some of the staff. Maybe they just volunteered to get theirs. But again, all the people that are here to support you are the course coordinators. Those are, the faculty in your courses that come before clinical, the course coordinators and course faculty, the regional clinical faculty who are your course faculty when you're in the clinical portion of the program. You have academic advisors and clinical advisors, financial aid officers, and credentialing coordinators. And these are just some of their photos. The guy in the middle is our IT champion, though. So, you've got all kinds of great people to support you. And IT and library, like they all we do a lot of Google Chat and Zoom. So like if you have a question for library or IT, they'll just get on Google Chat with you. And so you'll start to know people. Okay, I'm gonna let Bobby answer some of those nuanced questions in the chat right now. And I'll go ahead and take the next slide, please.
Yes. So Santana, you asked if you start the program and withdrew and you want to come back, how much time do you have to complete the program? Depends on the program. For the MSN programs, they have to be completed within 5 years of starting them. So if that's what you're referring to, MSN would need to be done within 5 years of starting it. When can we start applying? Yeah, so I'm going to go over that when we talk about applications, but we're currently accepting applications for the fall term. The classes start October 7th. Post-grad, Santana, I believe it's twice the time listed on the plan of study. So plan of study says 18 months, so it'd have to be within 36 months. Okay, waitlisted for fall. Typically, how long is someone usually on the wait list? That's a hard question to answer because it just kind of depends on, how many people apply and how many spaces they have. It can, by term, it can be different. I've seen people only be on the wait list a couple days and then a spot opens up and they are offered admission. I've also seen people be on the wait list for 2 terms. So you can be on the wait list for 2 terms. Before your waitlist expires and you would need to reapply. So it's kind of hard to really give a time frame, but I'm going to answer that with it depends. It really depends on the time of year and how many people apply and all of that.
Okay, thanks so much, Bobby. Once we graduate. Okay, yeah. So Olivia, I think you're asking like in that time period between graduation and like taking boards and getting credentialed as a clinician and all of that stuff, lots of people continue to work as an RN on the unit where they worked before. And let me see what Colette says. How long is the MSN program? Okay, I'm going to show some programs of study shortly. So everyone has had time to look at this beautiful illustration. So everyone's journey looks something like the lower picture. And we know that going in. So we have all sorts of processes in place to support you because we've been doing this long enough and with enough students that we know you don't just have this little straight line ride. Next slide, please. Okay, so I think there's some more detail about the programs of study after this, but to start out, we offer 3 different types of degrees. We offer a master's program and a postgraduate certificate program. The postgraduate certificate program is only for people, even if you have a master's or another advanced degree in nursing, you have to be an advanced practice nurse. So like a master's in nursing education or plain master's in nursing, those would not qualify you for the postgraduate certificate program. In order to be eligible for that program, you need to be an advanced practice nurse. So you need to already be a nurse midwife or a nurse practitioner. And you would be just seeking the opportunity to do a second specialty or a third specialty. So everybody on this call, I'm going to guess, is interested in either the MSN or the postgraduate certificate. DNP is a different topic, but I'm happy to speak to the why if we have time for that and people are interested. Our terms are 11 weeks long. We have 4 of those per year with 2-week breaks in between. To complete the straight master's program, that's going to be 2 to 3 years, depending on how many courses you take per term. For the postgraduate certificate program, it's going to take you 1 to 1.5 years. And the DNP program is an additional 18 months once you have a master's. Next slide, please. So maybe let's go back to that program of study one. I thought I had like more of a chart for how that looked, but so thank you for that, Rosalie. So to answer the question that a couple people had about how soon do I start clinicals? So clinicals take most students 3 terms. And so each term is 11 weeks plus a couple weeks of break. So it's basically 3/4 of a year. So like 9 months. So depending how quickly you progressed through your program, you would work back 9 months. So if you were going to take 3 years to do the program, you would start clinicals 9 months before 3 years. And likewise for the PGC, take 1 year or 1.5 years and subtract 9 months from that. There's a little bit of difference in the PGC if you're coming in. If you're in WHNP and adding midwifery, or you're in midwifery and you're adding WHNP, that's going to shave some time off because there's so much overlap. But if you're already a psych NP or a family NP and you're coming here interested in one of those tracks, that's going to take you more time because there isn't quite as much overlap in terms of the population that you've studied. I'm actually graduating next week with my FNP. Yes, Chris, you will. And like Caitlin said, during the clinical part of the program, it's very common for students to not stop. I don't know off the top of my head the minimum and maximum number of credit hours per term. It's not about courses, it's credit hours. Most courses are 3 credit hours, but some are not. So I'll let somebody else reply to that. I knew a dual program was offered. That's a great question, Carrie, and a very common question. My understanding is that we do not have a dual program, and my understanding is that dual programs are being eliminated in general for a reason that I personally disagree with, which is that many state boards of nursing are requiring evidence of a distinct 750 hours of clinical in each track that a student is looking to be, or that a graduate is looking to be licensed in. I think that's a very difficult argument to make when you're looking at somebody doing WHNP and midwifery, since the vast majority of the role overlaps, but I'm not state boards of nursing. So that's the reason you're not really seeing dual tracks anymore, is we would have to essentially trap you in a program that required you to do about 1,500 hours of clinical rotation, and that just seems unreasonable. So what happens if there's a lot of questions to be asked and answered about why would somebody even want both credentials, because almost every single thing you could do as a WHNP is encompassed in the midwifery role. There are a few things that are not. So the main reason people look to get both credentials is that they're in a state where the billing is different or the reimbursement is different, or there's some other sort of like politically motivated situation, because otherwise, if you wanted to be able to do both roles, being a nurse midwife would encompass that. So I'm always happy to talk more about this. I personally have both credentials, and I'm always happy to talk to students and prospective students about why I made that choice and what I think the pros and cons are. But that's probably too big of a conversation for tonight. Next slide, please. Okay, so admissions criteria, you have to be an RN with a current active license. Something that's unique about Frontier is we actually only require a bachelor's in any field. So most programs require a BSN. We don't require that. You could have a bachelor's in anthropology and also have an RN, and we would accept that for admissions criteria. I did that for the record, just so you don't feel like outliers if you don't have a degree in nursing. My undergraduate degree was in gender studies. And then I became a nurse so that I could become an advanced practice nurse. You have to have a 3.0 GPA, good academic standing, the 1 year of experience we talked about. It doesn't have to be labor and birth or gender health related. We do require COVID-19 vaccine. You are, again, able to request an exemption if you would like to do that. And then we talked about New York, and Bobby's answering about retention. Next slide, please. Okay, so admissions criteria for postgraduate students. Again, you have to have a current active RN license. You have to have a master's degree in nursing in an advanced practice nursing role. I apologize, Rosalie. I know I edited these slides. I should add that for next time. You can see the GPA and the other criteria. Oh, I have to edit it because we have a whole nother slide about that. Amazing. I just looked at this a few hours ago. Yeah, okay, next slide, please. Again, back to just circling back to the sense of community that we want to make sure that you have as part of your Frontier experience, which is somewhat unique for a distance program. Next slide, please. Okay, Bobby, back to you.
Okay, so I'm going to talk about application deadlines and application steps. And I just want to say I see so many familiar names in here. So it's so great to see you all were able to make it. Okay, so right now we are accepting applications for the fall term. Those classes would start October 7th. The deadline to apply for that is June 26th. And then on June 27th, the application for the winter term will open up. Those classes will start January 6th, and that deadline is September 25th. Remember Mariana asked a little bit earlier about, kind of some tips and tricks. So one of the things I will mention is that at Frontier, we do rolling admissions. So once you apply, we have everything for your application. It goes to the review committee and it gets reviewed and you get a decision usually within about 4 weeks. So rather than having to wait for that application deadline and everybody get reviewed at once, we review those applications as we receive them completely. So basically, what I'm trying to say there is it can be more beneficial to apply earlier in that application cycle because we do admit as we go. So that's my first little tip and trick, I suppose. Application steps. So first thing that you would do is the application on the website. There's a $50 application fee. After that, we will need official transcripts. So there's going to be a proxy form. It pops up after you complete the application, but you'll also get an email from one of us admissions counselors with that proxy form. You can fill that out, and that gives us permission to request your transcripts on your behalf. Some schools do not allow third-party transcript requests. So if that happens, we reach out to you and let you know that we will need you to request to have those sent to us. The remaining documents you email back to admissions, and that's going to be your current resume, a photocopy or a screenshot of your current active RN license, and if you are an advanced practice registered nurse, copy of that license as well, a current resume. So here's another tip and trick. There is an example resume on the website under the application section, and it also comes through in the email you receive from an admissions counselor. That example resume is very helpful because everything on that example resume basically is something that you could get credit for when your application is being reviewed. So you'll want, if you have a current resume already, you'll want to compare to that example resume and make sure if there's something on that example resume that applies to you, include it on your resume because we want you to be getting all the points, I guess you could say, that you should be getting for your application. And you'll also have to do an essay. It's the Mission and You essay. With the essay, I would say my biggest tip is making sure you're checking on your spelling and your grammar and all of that, and also letting the review committee get to know you through your essay. Your essay is really the chance for them to see who you are, who you want to be as a practitioner, what you're going to take out into your community. So those are kind of my tips and tricks. I know Mariana had asked about that. Tuition is currently $665 per credit hour. And yes, we're just talking about midwife and women's health. So we're good on that. And then let's see, questions. Marissa, how many students get accepted into each cohort approximately? I actually don't know. Those numbers are not shared with us in admissions. I don't know if somebody else might know that number. Takara, do you know spring and summer dates? Yes, not off the top of my head, but there. I'll find a link and post it in the chat in just a second. How many credits do we complete for the midwifery program? Okay, I'm gonna let someone else answer a couple of these questions before we go on.
Okay, sure. I think I got behind because I thought that I got past that. So let me see. How many students get accepted? Do you know the spring, summer dates? What percentage? So some of those up in there, if you could catch up with those, Bobby, and I'll start back over here with Chris, is the PGC online. So everything you do in the PGC, it's just a portion of what's in the MSN. So there are still 2 trips to campus, and then there are still online classes. It's just that you would get, we do a gap analysis for PGC students, and you wouldn't need to repeat content that you've already taken in another specialty area. Do many students work full-time? Yes, too many in my opinion, because sometimes people don't know how much time school takes and they don't leave enough time. So yes, I would even venture to say a majority of our students work full-time. But I really encourage you to think about what other responsibilities you have. Like if you're working full-time and for you, that means Monday through Friday as an administrator, rather than 2 12s on the weekend and, 1 additional day every 2-week pay period, or something like that. Plus you have small kids and you have other responsibilities, that would be something to consider, because everything takes more time than you expect. And you also want to this is an investment in your future in terms of actually understanding the material and not just sort of getting through it. But again, that said, many students do work. I'm going to let Bobby speak to the portfolio question. The total tuition is posted online, but I think it's also coming up in this slide deck. To Hananatu, all of the programs we're talking about tonight are master's level programs. And so midwifery and women's health NP are 2 tracks for the master's program. And so the midwifery program encompasses the skill set of a women's health NP. So nurse midwives attend labors and births, and also do prenatal and postpartum care, as well as GYN care and primary care for women and non-binary folks. And so that encompasses the vast majority of the WHNP role. The primary part of the WHNP role that's not encompassed in there, which may come to some of you as a surprise, is actually sexual and reproductive health care of folks who identify as male, even though the title of that credential is Women's Health NP. So if you're thinking like, I want to make sure I can also do GYN, like that's part of the midwifery program. I'm going to skip over some of these. The number of credits in the midwifery program, I do think is coming up on a future slide. Bobby's catching up on the other ones. If I'm applying for a specific term but can't make it to frontier bound, so frontier bound actually happens the term before you start. So say you're going to enroll in fall of 2025, you would come to one of the frontier bound dates in summer of 2025. How have students who work Monday through Friday completed clinicals in the past? That would be extremely challenging, and you probably would not be able to work full-time Monday through Friday, because you are required to, even if you're in the midwifery program, you are required to have time in an outpatient setting. So you wouldn't be able to, and it's going to require a minimum of 24 hours a week in clinical. So you couldn't like just do Saturday and Sunday. Okay, I think we're ready for the next slide. Yes, Carla, that's correct. Okay, so the clinical experience, regardless of your entry point, you will need a minimum of 750 hours of clinical. The minimum a person could do that in is 16 weeks, but I would need to do the math to make sure that that even makes logical sense. So don't think that you're going to get it done in 16 weeks. You're going to get it done in like 40 weeks. But just in case you were to think, I'm going to quit my job and move somewhere and do nothing except eat, sleep, and breathe my clinicals, we would still make you do that for at least 16 weeks, because you just need to integrate it. And midwifery specifically, because midwifery has a different accreditation body for our program, there is a minimum number of visit types, and it's competency based, but in reality, everything has a minimum number of visit types, and you ultimately have to be competent. So what that means is you can't just say, I went for all the hours and I did the minimum number of visit types. You also have to demonstrate to your preceptor and your faculty that you're a safe beginning level clinician. And we've built our program so that it's very difficult to not achieve that goal at the end. And there are many, many points of formative feedback along the way. But we just want to say from the outset that advanced practice nursing education is competency based. And so you, regardless of track, you are required to demonstrate competency before we send you out into the universe. Yes, Caitlin.
And Dr. Freed, I will say one other thing too, with the babies being on their own time frame. Oftentimes with our midwifery students, I do see them getting extra hours while they're waiting for their catches. They may be laboring with mom for 12 hours and then, it's shift change, or, we don't allow you to do longer than 16-hour shifts in one clinical shift. So you may miss the catch, but you've gotten your labor management experience. So it takes a while to get all of those components, especially that inpatient. So sorry.
Yeah, and you have to do all the things. You have to meet the minimum hours, you have to meet the minimum visit types, and you have to demonstrate competency. And again, typically all of those things align. And if they don't all align perfectly, you still got to do all the things. So yeah, so we really, just like I'm saying, leave more time than you think it could possibly take for doing your master's in terms of like the number of hours in your life. Because just by adulting, you've probably figured out that everything takes more time than you expect. Likewise with clinical. And if you can just show up and soak it in, it's so much better. I've been to graduate school many times myself and learned that lesson the hard way. And Lauren, absolutely, you can flex the number of credit hours that you're enrolled almost term to term to meet your needs. We are very well known for our flexibility, and we try to maintain that as much as humanly possible because, again, our mission and our goal is to develop healthcare providers that can work particularly in rural and underserved areas. And we know that people need to work and make money and take care of their families and move and all those things. So we are very flexible. Next slide, please, Rosalie.
If I could answer a question in the chat, it was sent to me as a direct message, but I think this is a good question to answer. So Augusta asked, can you apply before you get your APRN license? For the PGC, yes. So you do not have to have an active APRN license to apply for the postgraduate certificate. So yes, you can apply, right when if you finish an NP program and then wanting to apply for a PGC, you can do that.
Thank you. And Chris, I'm going to respond to your question verbally because I think it's confusing. So a course is 11 weeks long, but clinical just goes till you're done. So that's why on this slide, it says you have to be in clinical for a minimum of 14 weeks. It's going to take you longer than that anyway. It's just there are people that are like, I'm literally going to just live in the call room. And even if you were to complete all the requirements, we're not letting you out in less than 14 weeks. So that's why you see that discrepancy. And if that's still not clear, let me know. As I was told right now, I'm in an ADN program. You need to complete, so you need to have both a bachelor's degree and an RN license before you're eligible to apply. I think that's the answer to the question that's being asked.
Also, I think she had mentioned earlier that she was a midwife in another country. So something else is if you have that education, you can have that evaluated in the United States to see if your education is equivalent to a bachelor's degree in nursing or above, and then you wouldn't have to get that bachelor's degree in the U.S. So I will put the Frontier admissions email address in the chat. So if anybody wants to email us with questions like that and kind of tell us what your situation is, and then we can kind of help you navigate what you would need to do to be able to be eligible to apply at Frontier.
Thanks, Bobby. I'm going to go back up to Chris. So Chris, I'm going to try again. It is really confusing, and I hope I'm saying your name right. So a term is 11 weeks long, but when you're in clinical, you're going to be in clinical for like 9 months. Terms will occur during those 9 months, but your clinical courses are not as term bound as you may be used to. So you'll sign up for a clinical course for a given term, but you won't necessarily complete that course in the term. Like clinical just goes on till you're done with clinical. So yes, a term is 11 weeks long. So the short answer would be nobody's going to finish clinical in one term. You're always going to go over into the subsequent term. And most of you are going to take 3 full terms to complete clinical. Does that help? You can even say verbally if that helps.
Yeah, that does help.
Okay, I know it's really confusing.
Yeah, so
Do you
then
want to
now,
say more? Go ahead.
yeah,
Mhm.
would it go into then clinical two? Like, let's say if you start clinical one, would that go into clinical two?
Yes, but the short answer is it doesn't matter. Like you don't even need to know that right now.
Okay.
So, but you would not be able to like you have to take all three clinical courses regardless, but there's no possible way you could complete clinical in one term. That's the takeaway.
Yeah, it's kind of rolling terms and courses for lack of for lack of a better term. It is a way for us to assign you a grade as you roll through, and a way also for financial aid to allocate that packaging for your for your financial aid payments, your stipends. So does that help? But it
Yeah,
just kind
thank
of
you so
rolls
much.
through.
It makes
You're
sense.
welcome. Okay, cool.
And I started typing a response. I don't know the answer about when the person should apply, Bobby, for Jessica, but you come to campus twice. Once is the term prior to enrollment, and once is directly between the didactic or sort of classroom classes and your clinical classes. I want to expand this slide just because we've merged lots of slides and we've been taking questions the whole time. So I want to just, even though we see this sitting here with the question about life as a midwife, I at the same time definitely ask questions about life as a WHNP. I put the midwife one first because I'll just say short story. If you don't like staying up at night and you like knowing what you're doing from day to day, midwifery might not be the profession for you. I'm just being completely serious. It's extremely demanding in terms of hours and availability and lifestyle. It's also very satisfying. But that's one of the reasons we have this slide up here first. But if you have any questions about anything, like, is this even something I want to do? How would this fit with my life? What can I expect? You're certainly welcome to ask that now, or anything about anything we've gone over so far. Okay, somebody's got a question. Okay, so I can take either WHNP. So Hananatu, it might be helpful to look at the definitions of those types of clinicians, which you can find on our website. Those are two different but similar roles. WHNPs don't attend labors or births, but other than that, there's a lot of overlap. So both roles take care of pregnant people and postpartum people, and both roles do gynecologic and primary care for people who identify as female. Christina, that depends on what type of practice you choose to be in. So there are people who start their own practices or join a very small practice, or have a practice that focuses on continuity of care, and they might be on call all the time unless they take vacation and get somebody to cover for them. But they might not actually end up working very much at that time, right? So maybe they attend 6 births a month, they're on call every single day, but they're not away from home that often. And then there's other folks that take call less often, but they can expect, they might take call 48 hours a week, but they can expect to be awake that entire 48 hours. So there's a lot of variability there. I see some other questions popping up, maybe out of order. So let's see. Can you follow a physician? So in either track, you can follow a physician for up to 20% of the required hours. The rest of the required hours need to be with, for the midwifery students, the rest of their required hours need to be primarily with a nurse midwife. And for the women's health NP students, it can be with a nurse midwife, a family nurse practitioner, or a women's health nurse practitioner. Thanks, Caitlin. I see you answered at the same time. This is Takara, I wanted to pursue WHNP after the CNM. Nope, Takara, that would be your best shortcut. And it's not as short of a cut as I think it should be, but that is definitely your best approach, is to do midwifery first and then see if you think you still need to do the WHNP. And again, there's lots of pros and cons to that. Yes, so we do post on our website, not just the job placement rate, but the percent of students who are licensed are certified as a nurse midwife within a year. So no matter what kind of advanced practice nurse you're going to be, you need to graduate from an accredited program. Then you need to take a board exam, and that's how you get your certification. So that's how you get the title WHNP or certified nurse midwife, is by taking a certification exam. And then you need to get a license in the state that you live in. So our certification rates and our job placement rates are both posted on our website. Jessica, okay, we responded to Jessica. Would a WHNP, no, WHNPs don't provide newborn care at all. Carla, nurse midwives are trained to provide newborn care up to 28 days of life. It's actually quite rare for midwives to do that because even though we can train you in a scope of practice, state boards of nursing set the limits to that scope within each individual state. And so most states actually don't allow for nurse midwives to provide newborn care, even though every accredited program will train nurse midwives to provide newborn care up to 28 days of life. But WHNPs are not trained to provide newborn care at all. What is my favorite thing about being a midwife? It's actually the same. This is not a canned answer. This is totally spontaneous. And I love that question, Christina. My favorite thing about actually both roles is the immediate intimacy and I will say trust, although trust is not immediate, but that you establish with people. Like if you're somebody, like literally my dad and my grandfather are both clergy. I'm not particularly religious myself, but I definitely, when I was considering careers, I was like, do I want to be like a chaplain or clergy or midwife? I ended up being a WHNP first, but I think I like the same thing about all of it, which is being present for people during a really important time in their life and kind of cutting to the chase and establishing intimacy in that relationship. So I find that extremely satisfying. Let me see what else. Why can't we follow midwives from our unit if it's outside our work hours? Because, Sarah, that's a good question. That is because the university provides your malpractice insurance as a student, and our malpractice insurer does not want to get into any messy business where you're in the same unit in two different roles, and the university could be liable for something that you're doing in a non-student role. Can you do hours with a licensed midwife or certified midwife? You cannot, and that's not because we discount the skills for those folks, but because of our credentialing requirements. Yes, and Caitlin's answer is more accurate, but I'm just state to state, not always clear what those words mean. But the midwife that you follow has to be somebody that is certified by the American Midwifery Certification Board. Would you recommend having experience working in labor and delivery? That is a very common question and always a little bit complex to answer because I think there's pros and cons either way. If you have labor and birth experience, whether you're doing midwifery or women's health NP, you've got experience reading the fetal monitor and experience with cervical exams, and sometimes experience with labor support if you're doing midwifery. All of those things are very helpful because you don't need to learn them for the first time. What is challenging about having labor and birth experience first, if you're doing the midwifery track, is that you are very integrated into a particular role in the birth room. And it can be very challenging to get outside that role and take on the role of clinician. So again, we've had a bazillion students who've been a labor and birth nurse and a bazillion students who haven't, and we are set up to support you either way. One thing I will say that I've noted just really in like probably the last 5 years is in some geographic areas, it can be more challenging to find a clinical placement as a nurse midwifery student if you don't have labor and birth experience. I struggle with that for the reasons that I just said. And the reason that I think that I'm seeing that happen is that the acuity of the patients we care for midwives has really skyrocketed. And when you are in a very busy practice that takes care of a lot of high-risk people, the midwives essentially don't have time to teach you how to read a monitor and do cervical exams because you're taking care of some very sick people in very rapid succession. So the type of role that some midwives are in has changed significantly. So if you are looking for a clinical placement and you find that it's a challenge because you don't have labor and birth experience, we offer a lot of opportunities to kind of help you fill that gap. One of them is a no-cost 3-day weekend program called the Labor Skills Workshop that you can schedule right up against when you're coming to campus for your clinical skills time so that you don't pay for travel twice, and the workshop doesn't cost you anything. And then also, just in case I put a fright in anybody when I talked about working in a high acuity setting with lots of sick people, you can choose where you go as a student and as a clinician. I mean, if you're like, that's not for me, I want to work in a birth center or home birth practice, like totally valid. I just was speaking to what some students are encountering. Chris, okay, Bobby answered that. Oh, Caitlin, you're always so sweet. I work at a large hospital that has a separate triage floor. Taryn, what I'll say is that for most students, we can find a workable solution. And it sounds like there's lots of opportunities for you there to find a workable solution. I'm not able to speak directly to that individual situation right now. And yes, Jeanne, I think that, and I'm sorry if I'm saying your name wrong, I think that you maybe said that you're finishing your first master's now or something. So you would definitely be able to speak to that. Haha, Chris, the push to become a midwife. I always have to make a push pun. The midwives I work with are first assists. No, it's actually, there's a handful of things that our professional organization for midwives, the American College of Nurse-Midwives, says are actually not appropriate for beginners to learn during their first program. And those things include ultrasound, newborn male circumcision, surgical first assist, and a couple other things. So those are things, colposcopy. So those are things that we can certainly help you understand how you would gain that training, but that training is not part of your degree program here, or really in any program, because they're not considered entry-level skills. Yes, Santisha, we do what's called a gap analysis for any student who wants to submit other courses they've taken elsewhere. Yes, Francesca, that's something that's very unique about Frontier, is that you complete your didactic program in its entirety before clinicals. So the very first day that you go to clinical, you're prepared to encounter really anything. It's not like, oh, I've only learned how to do normal GYN, or I've only learned how to do postpartum. Caitlin, oh, thanks, Caitlin. Olivia, I enjoy my work as an L&D nurse, once certified in practicing. Yeah, you absolutely can, Olivia. Some of that's going to be specific to your state and the place where you work, but there's no like sort of big picture reason you can't do that. It's actually quite common. Whew, okay, we have like 90 seconds. What other questions do folks have? And Rosalie, I think the next slide maybe has my contact information. Oh yeah, we have so many students and preceptors in California. I have more than 2 full-time faculty just for students in California. Oh, pretty pictures of campus. Okay, I thought maybe it had my contact info. I will type it here. And I will stay on for any additional, oh, yeah, and that's how you get the staff email addresses are all on that slide. Oh yeah, Florida is our biggest state. Yeah, we have tons of students in Florida. I think we have the most midwifery students in Florida. Women's health is just a smaller program. So I'm not trying to give a short shift to the women's health students. It's just a smaller program and less challenging to navigate in a lot of ways, less nuanced. Yep, no issue at all with Florida. In fact, on the left-hand picture there, the individual in the middle in the gray scrubs is our lead faculty for Florida. That's Dr. Campbell. Wisconsin, yep, we've got experience in every state, including Alaska and Hawaii. Yep, no shortage of experience and faculty all over the country. Okay, it's 6 o'clock, time for us to sign off, and I'll answer one last question. The last question there, can we precept at birth centers? Yes, so there are some specifics about birth centers. They have to be accredited by the American Association of Birth Centers. I'm saying that wrong, CABC, which is the credentialing body of the American Association of Birth Centers. So they have to be accredited. Yep, we've got experienced preceptors on our map and faculty who are familiar with every single state you could live in. All right, I'm glad people got something out of it. You know how to find us, and we're gonna go ahead and send out the recording to everybody who registered. Thanks for being here.